Welcome to the Holistic Kid Show. My name is Zayn.
My name is Abdullah.
And I'm Imad.
We're the Holistic Kids here to educate us kids from the inside out. Did you know that 1 in 6 American children has at least one brain disease, like autism, ADHD, dyslexia, specific learning disorders, communication disorders? The list just goes on. And 50% of all lifetime mental illnesses begin at age 14. There's even a rise of another brain problem in kids known as PANDAS or PANS.
Wait, we're turning into bears?
No, PANS, PANS, or PANDAS, PANDAS, is a autoimmune disease or when the body starts to attack the brain.
Wait, so then after that we can turn into the bears.
No. Well, we have an amazing expert here to talk about just that.
Yeah, he is the leading expert in PANS or PANDAS. Dr. Scott has been a physician for over 27 years. He is a triple board certified in emergency medicine, integrative holistic medicine, and metabolic, nutritional, and functional medicine. He served as an active duty Army emergency physician for 7 years. Dr. Scott joined his wife at the Center for Fully Functional Health full time. He is also an author of on the Physician's Guide to PANS and PANDAS. So thank you so much for joining us today.
Oh, thank you. It's my pleasure. So it's my pleasure. What a fun thing to do. It's awesome.
So we would love to know how you turned into a conventionally trained medical doctor that became one of the becomes specializes in something most doctors aren't even taught about, but is a real problem in kids today. We would love to know your story.
Sure. So my story starts with, I'd been practicing medicine for about 20 years, and my daughter came to me. She was 12. Her name is Emma. And so she came to me one day and she really felt bad. And she started saying, I think God doesn't like me. I think I'm a bad person. And soon after that, she started washing her hands. I mean, 1 time, 2 times, 10 times, 20 times in a row until her hands were kind of bleeding. She had trouble sleeping and her grades in school just became terrible. She went like from a straight A student to having trouble reading and doing math and everything else. And we didn't really know what was going on. My wife, Ellen, is also a physician, and we really didn't know what was going on at the time. We were already functional medicine physicians, had an office. We'd never seen anything like this. So we called our pediatrician, and they weren't sure how to help us. And so we hit the books, right? So we started looking, trying to figure it out. And one day, my wife, Dr. Ellen, came to me and she said, I think Emma has PANDAS. And I kind of reacted like you reacted and said, the bear? I don't know what we're talking about. And so she gave me these medical articles and I started reading them. And it talked about something called PANDAS, which is pediatric autoimmune neuropsychiatric disorder associated with strep. Strep is a germ. It's a bacteria. It will give you, it's one of the causes of sore throat. You've probably all had a sore throat. And so what happens with PANDAS is kids get a sore throat, they get a strep infection, and what can happen is their immune system, you guys know all about the immune system. I know you've talked about it a bunch of times. It's what keeps you safe and healthy. Your immune system, rather than just attacking the bug that's in your throat, goes to the brain and then attacks the brain. And it causes kids to have a lot of fears, a lot of anxiety. It causes them to have something called OCD, obsessive compulsive disorder. So they have these thoughts they can't get out of their head. A lot of times those thoughts have to do with being dirty or being afraid of something, or sometimes these kids will feel like they have to keep asking the same question to their parents over and over again, or sometimes they'll feel like they have to confess things that are kind of silly. For example, my daughter, when she was sick back then, would say something like, when she was home with us, can I go to the bathroom? And we would say, you're home. Why are you asking? Like you're in school, can I go to the bathroom? So when we figured that out, we had to find someone to take care of her. No one in where I live in Indianapolis knew what it was. They didn't even know when I said the word PANDAS. So we had to take her all the way to New York, see a really smart doctor there. And he said, you're exactly right. This is PANDAS. And she needs some medicine to treat the infection. And she probably needs some medicine that goes through an IV in the arm. It's called IVIG. intravenous immunoglobulin. So she came back. I tried to help find someone, and I said, oh, great, I know what she needs. We'll get her better. And so I called around once again here, and I said, hey, my daughter has PANDAS and needs IVIG. Still, no one knew what to do or how to help me. So I had to take her all the way to Chicago to find someone to give her IVIG, because there's lots of smart doctors there in Chicago. And so they gave her IVIG, and about 4 days later, all of the fear, all of the trouble sleeping, all of those thoughts about washing her hands all went away. It was really cool, because what that IV in the arm does is it makes your immune system calm down. And once that calmed down, she got much better. And today she's really healthy. She's plays Division I soccer in college here. Indiana University, Indianapolis is where she plays. And healthy, feeling great. But that was my story. Then a few years later, they actually discovered that not just strep bacteria, but other bacteria, things like Lyme disease or mycoplasma, another bug, or Babesia or Bartonella, all these weirdly named bacteria can do the exact same thing. And so they said, well, the name PANDAS has strep in it, so let's just call it PANS, Pediatric Acute Neuropsychiatric Syndrome. That's where they came up. So usually when I talk about it, I might say PANDAS because people somehow now are starting to hear about it, especially since I wrote my book. But the correct term of everything is PANS, because that includes strep and all these other bacteria and everything. And even sometimes you can see similar things happen from exposure to chemicals, to mold in your house, all sorts of stuff like that.
Oh wow! And I think you said that most people don't even know what PANDAS is. Is.
When if I say pandas, they're obviously gonna think about the bear pandas. They don't really
That's
think
right.
about
And so just from me sitting here talking, you guys know more than some doctors. And doctors really, I always say doctors do the best they can. But PANDAS has really been described, I say, just since 1994, and you're like, we weren't even born yet. So that's a long time ago. But just since about 1994, people have been talking about it. But there's some evidence that maybe something like this was happening all the way back in, there was an article written in 1926, almost 100 years ago, about some kids who had the flu. The flu was really bad in 1918. And a few years later, like 6 years later, doctors started seeing some kids that had really, really similar behavior. Kids with PANDAS or PANS a lot of times also have a really hard time listening and obeying, and they kind of get sort of stubborn or defiant, people might say, or don't always behave. But what's interesting is it's not because the kids are bad, and it's not because they really want to be kind of not so nice. It's because they're scared. And so you can imagine if you were sitting someplace and let's say I took a snake and you were afraid of snakes, and I threw the snake in your lap and I said, hey, pet my pet snake. And you'd be like, I can't have that. And I said, no, it's cool. He's my pet. He's okay. And you're like, but it's a rattlesnake. I'm like, no, it's okay. He's a pet. He won't bite you, probably. And you'd be like super scared. And so then if you got up and ran out of the room and I started chasing you and saying, young man, I said, sit in the chair, like, you wouldn't listen because you'd be scared. And that's what happens with these kids. So a lot of times people see a kid with PANS or PANDAS, and maybe they don't want to sit in a chair in school, or maybe they don't want to do certain schoolwork, or don't particularly want to listen to their parents. A lot of times it's just because this disorder, these problems sometimes make them kind of really scared. And so that's what I always tell people. These aren't bad kids. They're kids with problem, usually infection, and usually their immune system's a little weird. And so that's what we work on fixing. That's how we help them get better.
Wow, that's amazing.
Amazing.
And also, besides PANDAS, I know something that's also really like related to PANDAS is like ADHD in a way as well, right?
That's exactly right. And it's interesting. A lot of kids who come to me, a previous doctor or health person who's seen them would say, hey, this child has ADHD. It might even start her on medication. And so when the kids will come to me, a lot of times we can treat them and then we can end up getting them off of that medication. And so parents might say to me, hey, was that like a big fake diagnosis? Did they not have ADHD? And I'll say, no, that's not it. Because if you look at what ADHD is, it comes from inflammation in the brain. It comes from something called oxidative stress in the brain. And sometimes we can see ADHD behaviors with infections or with toxins in the environment or a crummy diet or something like that. So sometimes just fixing those things will help things get better. And I say to parents, ADHD or anxiety or depression or all those things are just kind of lists of symptoms. So if you came and you said, hey, trouble sitting still at school and I can't pay attention, my grades are doing bad, and I just feel like I'm always distracted, I might look in a book and say, sounds like you might have ADHD. And then we might think about medications. In my office, we wouldn't start there. Certainly we would start with all the stuff and you talk about all the time. And I'm looking forward to reading your book about, which is diet and exercise and meditation or prayer or whatever, like all of those things that you talk about, same stuff I mentioned to them. And then at the same time, I'm looking for infections. I'm looking for toxins. Maybe their house is moldy, or they might live near a place that has a lot of farming where they spray pesticides and things that can affect your brain. All those things are associated with ADHD. So you're right. ADHD is a big problem. Interesting fact is that sometimes when kids have ADHD symptoms and they're started on the medicines that work well for a lot of folks, when they have PANS or PANDAS, they get a lot worse. They get a lot more hyper. They get a lot more scared. Their anxiety gets worse. And sometimes that's a clue to me. If parents come in and say that, I think, I know, I wonder, this sounds like it could be PANS or PANDAS. So
why do you think that like ADHD and autism, a lot of these are on a rise, right? Autism is now in like I think in 60 kids. But it's a lot, like the statistics are a lot worse than what it was like 20, 30 years ago. So why do you think mental health problems are on a rise in kids? We would love your expert opinion.
That's a great question. And that's absolutely true. And sometimes if we look at this and we say, hey, something's increasing, sometimes people say, maybe we're just looking for it more. But the way that we understand anxiety or depression or even ADHD really hasn't changed in the last 20 years. So they haven't changed the amount of times they're looking for it. They haven't changed the definition of it. And so you're right. We are finding more of it because there's more around. More kids seem to be affected by it. And there's even proof that occurs in adults. If you look at things like diabetes, about 25% of kids that when they graduate from high school have elevated blood sugar. They have signs that they're heading towards diabetes, something called insulin resistance. But mental health things, if we say, well, why are they increasing? And I think the reason they're increasing is a lot of the things you guys talk about every day about trying to prevent. So your immune system in your body doesn't just react to strep bacteria or mycoplasma or the flu or COVID or something. It reacts to preservatives in foods. Very well known that reducing preservatives in foods reduces ADHD. Reducing artificial foods reduces the chance of heart disease and reduces the chance of depression and anxiety. In fact, just by eating what you might call a nutrient-dense diet or whole foods diet, you might call it, right? Those types of things supply certain nutrients that make the brain run correctly. Interesting fact is that a lot of the chemicals that run your brain that make you remember or make you calm or make you excited or any of those things, a lot of those chemicals or even make you happy are produced in your stomach and in your intestines, actually in your intestines. And so if you're eating lots of food that's not so great for you, or if you're under a lot of stress and you're not doing some things to help with stress, stress breathing exercises, meditation or prayer or whatever, mindfulness, if you're not doing all that stuff, then that's going to affect those chemicals getting to your brain correctly. And so we can expect to see increased risks of those things. There's all sorts of other things in our environments. You may have heard about things called forever chemicals. Those are chemicals that are in the environment, in the ground, in the water, everywhere. Plastics, there's plastics in a lot of our foods and water. And those things stick around for a long, long time. Think about if you had a plastic water bottle and you just set it outside your house, 30 years, 40 years, 50 years, plastic water bottle will still be there. So those things take a long time to go away. And those forever chemicals, babies that are now born, if you take their blood right when they're born, some of them have as many as 300 chemicals already in their system that they got from what's in the mom's body. And so the rise of chemicals, the reduction of healthy foods, and the fact that people don't emphasize healthy foods, right? If you think about your friends, a lot of what we do in our country is, for example, we lost the baseball game. Let's go get an ice cream cone. Or we won the baseball game. Let's go get an ice cream cone, right?
Exactly.
So we reward that. And of course, Halloween's coming up and everybody kind of stocks up on candy and everything else. So those additives in foods and the lack of healthy foods, and even things we know that what can improve ADHD and other mental health struggles, exercise, simple stuff, right? And a lot of what I teach kids who are really anxious is I'm working on looking for infections and getting them done, and looking for toxins and getting them removed. And I'm looking for, how do I fix the immune system? There's some medicines I use for that, or some natural supplements and things. But I'm also saying, hey, while you're uncomfortable, while you're anxious or while you're scared or whatever, while you're having trouble sleeping, let's talk about some other stuff that you can do. How about getting out in the sun early in the morning and getting sun on your face? That increases something called melatonin like 12 hours later, which will help you sleep. Exercise, we know, improves sleep. So all that kind of thing. But boy, you hit the nail on the head that these diseases are increasing. Autism, ADHD, depression, anxiety. I know, when I went to school, kids weren't on a whole lot of medicines. And now lots of kids are on medicines. And the other interesting thing is lots of kids have allergies, don't they? It seems like everyone has an allergy. Like you can't bring, not that I would tell you to bring cookies, but you can't bring cookies or cakes into school because if something could have nuts in it, people are allergic. So that's proof kind of that our immune system isn't doing what it used to. It's almost as if our immune system is weird. So it's marking everything as an invader or an enemy, and it's making these allergies, which then are affecting people. So all that stuff is on the increase, and I can only blame the lack of whole foods. You guys don't understand how fortunate, maybe you do, hopefully you do, understand how fortunate you are to grow up in your family where, your mom is so good about stressing the things the healthy things to eat and healthy habits and those other things, because the stuff you're doing now will affect how you feel in your 20s and your 30s and 40s and 50s, right? Because you want to be healthy throughout your whole life. So if you have grandkids, you're able to get down on the ground and play with them and do stuff and teach them all about when you were their age, all that kind of stuff. Yeah.
Yeah, and I think you're also mentioning how nowadays a lot more kids have peanut allergies. It's kind of like normal to have to sit at the peanut allergy table.
Oh yeah. And it was never when I was little, and medicine has improved the way we practice medicine. So yes, we're finding some things earlier that we didn't look for back then, but no one can kind of deny that that kids are more anxious, kids are more depressed. There's kids that really, really struggle with mental health, and a lot of folks are medicated. And it's not necessarily wrong to take medication, because sometimes those things are needed, just like sometimes you might need an antibiotic. But gosh, if we could do so many of these other things that are cheaper, easier, have no side effects, how great is that?
Pretty great.
And so for people that just came on, what are those simple things that people can start to limit the chance that their child develops PANDS or ADHD or any of these problems that a lot of kids are facing today?
Sure, that's a great question. So to prevent it, so what you want to PANS and PANDAS start with an immune system that's not acting right. So you may have had strep. I had strep when I was little, and I never got PANDAS. So some of it is your genetics, like what your body's made of, and sometimes PANS and PANDAS are autoimmune diseases where your body kind of attacks itself, and those tend to run in families. So sometimes we'll see two brothers or a brother and a sister or two sisters with PANS. So there's definitely a connection with genetics and what your body's made up of. But all of these kids that we see, what's happening is their immune system, what's supposed to happen is it's supposed to attack any invader and then kind of go back down to normal. And in these kids, it's attacking when it's not supposed to. Sometimes it's not attacking at all. So their immune system's kind of off. And so that happens. And what causes that? Toxins. In almost every single one of our kids, we will find mycotoxins, meaning they were in a moldy house or a moldy school. And that really messes up their immune system. So then when they get this strep infection or whatever else that you and I might get, that'd be fine. Their immune system goes crazy and attacks their brain, and then they get all these symptoms. So if we're looking at how to prevent that, we'd be talking about things like making the immune system strong. Lots of the same stuff. So healthy diet, exercise, all those things, stress reduction, all of those things make a strong immune system. And then also looking in your environment. So having a clean house, in other words, not just that it's not dusty, but making sure you don't have a bunch of chemicals around the house, or there's no mold in your house. You might want to make sure if there's been a water leak, someone looks at it and looks for mold, things like that. Or asking the question, could the school have mold in it? And so those types of things prevent your immune system from getting off. If you've already had PANDAS, in other words, if their parents are like, hey, my kid's having some strange symptoms, and it sounds like what that guy said on that cool podcast with those three dudes, what do I do now? And that is what I like to talk about that all the time. So it's important to find someone as a parent who listens to you, even if they don't know a whole bunch about PANS and PANDAS, someone who listens to you. And if you say, boy, my kid has a big problem, that the doctor doesn't say, I don't think it's anything, or it's kind of normal. Some of these kids will get tics. They'll get blinking tics where they blink or they squint or move their mouth funny, or they might twitch their head. And sometimes parents will take their kids to the doctor, and the doctor say, well, this just kind of happens to some people. When I see that in my office, that's a huge clue for PANS and PANDAS. So find someone who listens, A. B, if you can find someone near you who takes care of PANS and PANDAS, there's a website called the PANDAS Physicians Network, where you can put in your zip code wherever you are in the United States and find someone near you. And in my office, we have people from all over the country come. And so we always need to see them their first time in person, but they come from all over the country. And then we can usually do follow-ups on the phone or like this on Zoom, not on StreamYard, but on Zoom. And so people can do that. So it's important to find someone. If you're somewhere where no one really knows about it and you can't really go anywhere because maybe your kid's a little too sick, my book is a good resource, The Comprehensive Physician's Guide for PANS and PANDAS. I've told several parents have told me, I should say, that they bought a copy and gave it to their doctor, and their doctor then was willing to work with them and order blood tests or order some other things that they might need. So I think that's the thing. But sometimes before I wrote my book, I would get calls sometimes. I remember I got contacted by someone in Australia, and don't ask me what time it is there. So I had problems figuring out what time I had to be on here today, because you guys are an hour earlier. But they contacted me from Australia and said, what should I do? And I told them, first thing I would do is check your house for mold. Second thing I would do is take anything processed, high sugar, processed sugar out of your diet. Make sure the child's getting whole foods kind of a diet, and kind of start there. And that's a good place to start, because sometimes if you do that, their immune system will become normal, and they will beat the infection and things will go away. So sometimes just by changing the diet, not often, but sometimes just by changing the diet when you're in a situation where you can't go anywhere, will really, really be helpful.
Yes.
What lab
Amazing.
tests can parents ask their doctors to run if they believe this could be a problem, including like PANS and PANDAS?
That's a great question. It's a great question because you might not, if you don't see these patients every day like we do in our office, you might not know that. And like you guys said earlier, a lot of doctors don't know about this. So what could parents ask? That's a great question. So the simple stuff, not every doctor might know about tests like urine tests for mycotoxins, or they might not know about testing for specific things that we do in our office. But some simple things might be to check for strep in the throat. And there's a blood test you can do for that, or there's a throat swab you can do for that. That might be something to start with. And if those things show strep, then it would be a good place. And the child's having these behavioral issues, that would be a good place to start. You can also do just through even a regular lab. You can do lots of levels of vitamins, magnesium, minerals, magnesium, vitamins, B vitamins, all folate, B12, all those things. You can look at just even with a regular lab. And then one of the big tests you have to look at, and in fact, in Chicago, in Indiana, where I am, all over kind of what we would call the Midwest, there's a lot of kids getting infections now, even kids without PANS and PANDAS with something called mycoplasma, causes a really bad cough. You may have seen someone recently that had this cough and they just couldn't get it to stop. It's like all night. They're like up all night coughing. People are like, what the heck? And it is from this bacteria and mycoplasma. A lot of times we see in kids with PANS and PANDAS, well known from years ago. So checking mycoplasma blood work is a good thing to start. And that can be almost taken from any lab. Now, when you're looking for things like Lyme disease, I know you talked to my friend, 3 years ago, Dr. Tom Worcroft, probably about Lyme disease and things. Sometimes
I remember,
Yeah.
that guy, sometimes he's funny. Sometimes that requires some special testing. There's a company that I use called Igenix, and that's a special test because it's really, really good at picking up Lyme disease and Bartonella and Babesia and all that kind of stuff. So those are some kind of tests where I might start. And sometimes if you're in a situation and behavior's changed, sometimes just asking your doctor for strep testing and then asking them, look, would it be okay to treat with an antibiotic for a period of time? Sometimes some kids just with antibiotics alone will get better. Weird, right? But just all that behavior, the scariness, the trouble sleeping. Sometimes these kids will cry about things. It'll just kind of go away. It doesn't always happen with just an antibiotic, but that's where I would kind of start. And I have a lot of information on my website. It's called the pandasdocs.com. And there's a lot of information there for parents. There's an online program parents can sign up for that has all of this information, really, really specific information like, hey, these are the 10 tests I order, or this might be a way I would start treating this infection, or hey, here's good stuff to do with your diet, or even what do you tell your school about what's going on so you don't get in trouble if you're just struggling with something, but not because you want to be kind of not so nice or not do work, but if you're just struggling. So.
Well, this was amazing. Where can people learn more about you and your work? Right, Imad? Right, Zan?
Yeah.
Mm-hmm.
Well, thank you. People can go to the Pandas Docs on Facebook or on Instagram, or thepandasdocs.com is my website. And I have my book available there. It's cheaper than Amazon on my website. And also have my online PANDAS program there that parents can get to connect them to kind of how I think about cases and what I do and that kind of thing. And if they're interested in coming to see us, we are at the Center for Fully Functional Health, and that's fullyfunctional.com. And that is the best way to get an appointment there. And there's phone numbers there and things people can call. And we'll get one of our expert staff to talk to them and tell them all what they need to know. And just to tell them, we understand that you're having a hard time.
Wow, you are so inspirational.
So inspirational.
Especially for the parents that were really looking for answers. We are so thankful for your work.
So thankful.
So thankful.
Thank you again for all your time and wisdom today. Thank you so much, Dr. Scott. Let's recap Dr. Scott's key points.
Yes.
Kids' mental health is suffering. The stuff we are doing now will determine how our health will be when we are older. There are so many things we can do that are cheaper, faster, and easier. We also need to keep our immune system working strong. When our immune system is not working the way it should, it can lead to brain diseases like PANDAS. Nutrients help the brain run correctly. And we also need to improve our diet and get rid of junk food. Eat whole foods.
Low toxins in your environment, forever chemicals and microplastics, lack of healthy foods, of exercise can throw off your immune system. Early morning sunlight, exercise, improving sleep, having a clean house, lowering the chemicals in your house. Look for the mold and at home or school, as all of that can affect your immune system.
Find a practitioner that will listen to you and have them get Dr. Scott's book that will help you understand what to do and what labs to run. There's so much we can do to help our brains and make sure our immune system works the best it can. So thank you again, Dr. Scott, and thank you everyone for tuning in. Until next time, I'm Zansari.
I'm Abdullah.
And I'm Iman.
Follow my family and I on social media, Holistic MomD, and look out for my mom's book that came out a couple months ago, Adam Tilling Adventures, Fake Foods versus Real Foods, which I actually illustrated. And stay tuned to our book, The Teen Health Revolution, releasing 2025. Kids need to learn from other kids. Please download our podcast in iTunes and leave a review so other kids and families can benefit. We need to work together to create a healthy future for all of us and the planet. Join us next week for another episode of the Holistic Kid Show, where kids are empowering kids. Thank you, everyone.
And thank you,
Yeah,
Dr. Scott.
Thank you. Take care, guys.